stem cells and Parkinson's disease. We're well aware of the role of stem cells in the treatment of various neurological disorders, and today we'll be taking up Parkinson's disease vis-a-vis treatment by stem cell therapy. So first of all, we have to understand what are the stem cells. So as far as the stem cells are concerned, you have to remember that the stem cells are unspecialized cells. A paradox, though we consider them as specialized cells, but they are unspecialized. But they have got a capability of differentiating into specialized cells. So being unspecialized themselves, they differentiate into various specialized cells like the neurons, like the muscle cells, like the blood cells. That's a very unique capability. And what's more important is that they have got this property of self-renewal. That means that they can renew themselves unlimited. The unlimited capacity of self-renewal gives a long-term beneficial treatment to the patients. So as far as the stem cells are concerned, these are very important features. Now, where from do we harvest the stem cells? This is dynamic because the stem cells can be harvested from any source. The stem cells can be harvested from any source. And what are the various sources of harvesting the stem cells? Is that we can harvest the stem cells from tissues like pre-embryonic stage. That means we can just harvest these stem cells from the amniotic cavity itself. In the pre-implantation stage, from the umbilicus, and in the adult life, post-embryonic, from the children as well as adults. So there are multiple sources from which we can harvest these stem cells. So as you can see over here, that we can just get these from the embryonic tissue, we can just get them from the adults, we can just get them from the amniotic cavity themselves and the umbilicus as well. So now, what are the therapeutic applications of the stem cells? Basically, in addition to that, we have got two types of harvest. One is the autologous harvest and another is the allogenic. And what do we mean by autologous? Autologous means self, that we take the stem cells right from the individual himself and or herself. And the allogenic, once there's a donor and he or she donates the stem cells. So that is very, very important. So as far as the stem cells are concerned, we have got these two things which come there into being. Now after that, what is important? What is important is that we have got the Parkinson's disease. And what is this Parkinson's disease? This Parkinson's disease usually occurs in elderly patients who present with tremor, rigidity, bradykinesia, akinesia. And the tremor is pill rolling tremor, 4 to 5 hertz tremor. There is expressionless mask-like facies, and there is instability of the gait, as well as, increased muscle tone. So basically, the issue lies within the nucleus. And which nucleus? It is the substantia nigra. The substantia nigra is a very important nucleus where we have the depletion of the dopamine secreting neurons, and this is the basic pathology. So what the stem cells do, they just replace these lost dopamine secreting neurons. And what happens, we do this through a procedure. So this procedure is very important, that we inject the stem cells into the specific areas. And how do we recognize these specific areas? Through a high resolution MRI. So the high resolution MRI, what the high resolution MRI does, it identifies the area which is deficient in dopamine secreting neurons, and especially substantia nigra in this case, and it is done through a very specialized stereotactic procedure wherein we have to reach this specific area. And what is important is that once we inject the stem cells, there is a maturation period. The benefit does not happen immediately. The stem cells take time to mature and replace the dopamine depleted neurons. And now we have the normal cells, we secrete the dopamine in these areas, and they restore the functionality back. But it takes time of months together to have this benefit. Now after that, what happens? We see that is there any improvement? Yeah, clinical studies all over the world have suggested the rates more than 80% success in this procedure in case of primates as well as humans in the leading research centers of the world: US, UK, Germany, France, Spain, Britain. Everywhere we have got the research going on, and they have established improved tremor, improved motor activity, improved rigid improvement in the rigidity, improvement in the movement, and that's important. And the decreased need of medication by injecting these cells into those areas. Now, is there any issue with the transplant? Yeah, we can have some issues like, we can have the issues like tumorogenesis, small malignant potential once injecting the tumor cells, then immunosuppression. In case of immunosuppression, by virtue of giving immunosuppressant therapy, you know the complications which are associated. And then because it is to be done in a very important area, the brain, so increased chance of infection and bleeding in those areas. So this is something about the role of stem cells as far as the Parkinson's disease is concerned. And now, having seen the role of stem cells not only in Parkinson's disease, the therapy is extended more towards diseases like multiple sclerosis, the modern pandemic, Alzheimer's dementia, as well as the diseases like Batten's disease. And the role is evolving, and there's increased research focused on stem cells. So this is a very beneficial talk of mine. I think that it will be benefiting you a bit. Thanks a lot.